For implant surgery, the doctor can use two main methods. The first method is called Freehand, where the doctor implants based on their experience, knowledge, and skills. This technique involves the doctor implanting directly into the bone, which can be quite quick, but the positioning may not always be entirely accurate. This type of surgery is known as freehand implant surgery, or implant surgery without guidance. The second type is guided implant surgery, which has three main categories. The first is static guidance. Static guidance means the doctor will use surgical guide. These plates contain metal tubes that guide the doctor's drill tip for implanting. That is static guided surgery. The second aspect to consider is dynamic guidance or navigation systems designed for precise routing. With this innovative system, as the doctor carefully implants, the camera seamlessly connects to the patient. It will connect the patient information, and information about the drill, so when the doctor places the implant, it will be guided by the pre-planned strategy. This way, as soon as the doctor sees the images on screen, they will know the patient's bone structure and the location of the nerves, ensuring that the implant placement is very accurate. The third type is guidance by robots. Currently, there is no such robotic arm system in Vietnam. However, in the near future, we may have guidance provided by robotic arms. At Elite Dental Clinic, we have been applying guided digital surgery techniques for quite some time. While static guidance offers benefits, it has some drawbacks, as its accuracy is not completely guaranteed in all situations. Secondly, it is quite rigid. If the doctor wants to make changes, they cannot. Sometimes the doctor has to rely on the guided template. Therefore, our dental clinic wants to upgrade and invest more to improve treatment outcomes for patients, so we are investing in DCARER Navigation Systems, which is part of the Dynamic Guidance System to assist in implant navigation. The Dynamic Guidance System we use is also part of the digital process applied in implant treatment. When patients come in, they also need standard information, such as cone beam CT information, combined with data from scans of the area where teeth are missing. Next, we will integrate that detailed information regarding bones and teeth into the software within the guidance system for improved functionality. In the system software, the doctor can plan the implant according to the future tooth positions. The implant must follow the location of the teeth. From that specific implant position, it will effectively guide the doctor on the precise location to drill into the jawbone for optimal placement. The software contains a complete library of drill bits, indicating how many drills are needed. In addition to the specific type of bone being examined, the doctor can view the patient's bone structure on the computer screen while performing the drilling procedure. Thus, all information will be synchronized. The doctor will have a clear understanding of the exact location where the drill is entering the patient's jawbone, allowing them to carefully avoid any surrounding nerves. Therefore, the dynamic guidance system will help the doctor place the implant very accurately, utilizing the patient's bone structure while avoiding important anatomical structures such as the maxillary sinus, nerves, or adjacent tooth roots, providing the doctor with flexibility compared to the static guidance system. The advantage of dynamic guidance is that it is very flexible. When the doctor performs the implant procedure, they will utilize a sophisticated camera system that is connected directly to the patient's jawbone and the implant drill. As the doctor carefully drills into the patient's jawbone, they can observe the precise position of the jawbone, the exact location of the maxillary sinus, and the surrounding nerves displayed clearly on the monitor. This advanced visual aid allows the doctor to adhere closely to the initial surgical plan. Consequently, for the surgeon, the positioning of the implant will be significantly improved, ensuring greater accuracy and enhanced safety throughout the procedure. For the prosthodontists, who skillfully performs the crowns on the dental implants, there are also numerous significant benefits to consider. This is because when the prosthodontist builds on the implants, the crowns are meticulously and accurately positioned thanks to the advanced dynamic guidance system, which significantly simplifies the prosthodontist's work and ultimately leads to longer-lasting, more durable, and flexible results for patients. Secondly, the overall implementation and planning time will be significantly faster, requiring considerably less time when compared to traditional static guidance and the duration needed to print various models and trays. It usually takes a long time to do. With our guided approach, when patients arrive, we can efficiently proceed with their treatment on the same day after thorough planning. The indications for the guided system can effectively be applied in virtually all situations. That is, from single tooth loss, partial dentures, to complete dentures. From simple cases to complex ones. Not every dental facility is able to implement this advanced technology because the investment in this sophisticated system is quite costly and requires a significant amount of the doctor's time to adapt to the new procedures and protocols. Research studies have consistently demonstrated that utilizing guided techniques for procedures is generally more accurate than performing surgery without any guidance. Therefore, when we apply this treatment, we strive to use it in most cases, particularly when patients have lost one or more teeth.